154 COVID-19 cases and has been instituting measures to curb the spread of the virus, which include training of 1,100 healthcare workers in batches. And now our Alan Ochanda is in Nakuru for us. Good afternoon, Ochanda. It's great to see you. Is the CS there? And what time do we expect the briefing, Ochanda?
Well, Grace, good afternoon to you. Yes, we are expecting the Cabinet Secretary for Health, Mutahi Kagwe, to be issuing the daily brief on COVID-19, on the situation of the COVID-19 in the country here in Nakuru County. But before he does so, there is actually just meeting different stakeholders. Of course, the governor and those drawn from the health department here in Nakuru County is set to visit some of the venues that host the just act as the training sites for the 1,130 healthcare workers here in Nakuru. But as you can see just behind me, these are some of the healthcare workers who are undergoing these training here. And this site, there's a domicile here in Moi Primary School here in Nakuru, is one of the sites that the Cabinet Secretary is expected to tour and just meet these healthcare workers, of course, in preparations with combating the spread of the COVID-19 virus. And so just joining me is Madam Rita Ochola here, of course, the county community health focal person here in Nakuru, to just give us an update of what we expect here. Madam, if you could just come here so that you could just speak on KTN News here, because she appears to be still fixing some things here in anticipation of the Cabinet Secretary here. Madam, just tell us what we expect here, the number of persons you've trained here in terms of healthcare workers, and of course, do you anticipate or plan to dispatch them to the informal sector or to the hospitals or to in anticipation of the home-based healthcare protocol that we are expecting in the country? Thank you.
As you've said, my name is Rita Ochola. I'm coordinating community health services in Nakuru County, and by Friday, we are going to dispatch a team of 1,100 community health volunteers who have just finished their training for the last 2 weeks. And they are going to support the community health services at the community level. And their main work is prevention and promotion of health services at the community level. So anything to do with the health will be part of what they will be supporting the system. And more so the UHC agenda that we are working on as a department, as a ministry, and as the whole county. Our president is working on that.
Maybe as you train them with the county, of course, you are cooperating with the county and other stakeholders. Are you now arming them with the necessary equipment like the PPEs, or maybe we are still meeting some shortage of the PPE supplies in Nakuru County?
That has been planned. They will receive the support that is required for them to roll out the activity and continue working in the community. Thank you.
Well, nice. Grace, we are now expecting the CS will actually be touring such venues where they are training the healthcare workers. And remember that they will be dispatched to the informal sector to just ensure that remember that if the virus really lands in the informal sector, then it becomes quite a tricky affair here. But to be forearmed is to be forewarned is to be forearmed. Here you can see that they are now arming so that they could just handle just in case there is a breakout in the informal sector. Grace.
Indeed, Ochanda, but before I let you go, days ago we did have... Okay, thank you, Philip. Apologies, Ochanda. Let's move on to the world of sports now. And Kenyan top-tier football can now breathe